Good evening, and thank you for joining us. My name is Tomas Salmonte, and I am Deputy Chief of Staff to Mayor Bowser. We want to thank you for joining us for tonight's Community Leaders Call on the coronavirus COVID district response. We're going to kick it off with opening remarks with Mayor Bowser, but want to remind everyone again, for the most up-to-date information and resources, please visit coronavirus.dc.gov. Without further ado, we'll go to Mayor Bowser.
Good afternoon, everybody. I'm so pleased to be able to provide a brief report to you. I'm joined today by Dr. LaQuandra Nesbitt and Dr. Christopher Rodriguez. Dr. Nesbitt leads our health response. She is the director of the D.C. Department of Health, or D.C. Health. And Dr. Rodriguez is leading our emergency management response. He is the director of D.C. Homeland Security and Emergency Management. As we get started, I want to say thank you to all of our residents who are heeding our warnings and all of the orders that I have issued to stay at home, to not go to not do non-essential business. As of 10 p.m. tonight, non-essential businesses in the district are ordered to be closed. You already know we are going into our second week of distance learning at our schools. Our schools have been closed. Our bars and restaurants, entertainment facilities, museums, convention center have all been closed. And now it is time for all of us to do our part to help blunt the spread of the virus by staying at home. If you don't need to be out, don't be out. We are also encouraging anybody that we see congregating in public parks or public places, they will be asked to move along. So basically everything in our city is closed, and we are all making the tremendous sacrifice of stopping our everyday lives so that we can get on the other side of the spread of this virus more quickly. I want to thank all the D.C. government employees who are helping to keep the government running. You know, we are operating in a modified status, so many of our services are being completed remotely by D.C. government workers who are teleworking. Still, thousands of D.C. government workers are reporting to their workplaces. They include firefighters and policemen, our human services workers, our folks working on unemployment claims as well as our executive staff, HCMA and DOH staffs who are leading our response. So I want to say thank you to them for making sure our government can continue to run. I also want to acknowledge and thank our elected officials. I have been staying in constant contact with members of the council who moved into action right away to ensure that we had the emergency authority that we needed, not only to operate during this emergency, but to fund some very critical early local relief for small and local businesses. So I very much appreciate them for that. I also want to acknowledge and thank our Congresswoman who I briefed last night on all of the issues happening in the district, and continue to call on her and rely on her support for everything that we need coming from the Congress of the United States as well. So we are seeing on the ground what Dr. Nesbitt and her team expected. That as testing increases, so do the number of positive cases going up in the District of Columbia. We expected that, and we expect that that might also continue. And the only way to reverse that trend is for everyone to stay at home. Locally, I have already directed $53 million to our city's COVID-19 response and recovery. This includes $15 million that went through today to purchase ventilators, more personal protective equipment, testing supplies, and medical supplies, and other necessary equipment. And we continue to call on the White House for procurement support. We in cities and states need to collaborate on our responses with national cooperation, not compete for life-saving supplies. So with that, I want to thank you for joining this call, and we will pause. Dr. Nesbitt and Rodriguez and I are available to answer your questions.
All righty, thank you so much. Again, we want to make sure that residents press 0. If you have any questions, you can press 0 now, and we will begin to call on you for questions. We want to also thank all of you watching us live online from our live stream, including and Channel 16. We want to thank the council members of the DC Council for hosting watch parties for the live stream of this call as well. So we'll go to our first question. It's from Rodney Foxworth in Ward 4. Go ahead, Rodney, you're live.
Hi, Mayor Bowser. How are you guys doing?
Great. Thank you, Rodney.
Just want to know if you could give us a quick update on the medical volunteer group, and if there's other ways that people could volunteer outside of that group, like I could be a driver for DACL or any other agency that's providing food to seniors, people that are medically not able to go outside, that kind of stuff.
Thank you. I'm going to turn to Dr. Nesbitt to talk about our Medical Reserve Corps.
Sure. We continue to receive applications for people to participate in the Medical Reserve Corps. We received over 1,600 applications so far. The vetting process is going very well. People who are not currently licensed health professionals have to be vetted through the process, which includes having a criminal background check. The licensed health professionals have already begun to receive training. There was a large training held earlier this week that helps them prepare for a number of roles that we anticipate can be relevant in the future. We're really focused on having individuals, whether you be a health professional or a community member who is a non-health or medical professional, joining the Health and Medical Coalition at this time. As we anticipate our medical surge needs, that is our most critical area of need at this time. We do have opportunities on coronavirus at dc.gov for people to link with other community support agencies and community-based organizations who are in need of volunteers and donations, and you may continue to work through Serve DC for other opportunities. But primarily at this point, we really want people to serve with us through the Medical Reserve Corps.
Great. We'll go to our next question from Sultan Shakir. Sultan, you are live.
Hello.
Hello. So this is a question from a community member who's concerned because they go to dialysis 3 days a week. It's medically necessary. The concern is that the location is not physically set up for social distancing, and when they've asked the staff everything about protocols to what happens if they're required to self-quarantine, what they should do given that they can't stay home and they have to go back to the dialysis location, and they're just concerned that they're not getting any type of response from the dialysis provider. And so the question is, how can the city work with people who are medically required to leave their house and go to another location? One, ensure the locations are set up to social distance, and two, that they're getting responses about what they should do and how they would get support for their medical needs if they're required to self-quarantine. Thank you.
Well, certainly individually, if you want to share with us that location, we can make sure that somebody from the health department is contacting them. But I think more broadly, Dr. Nesbitt has given some guidance for those providers.
Yes, we have been working directly with the dialysis centers, those that operate as outpatient facilities, as well as those that are affiliated with our health centers. We have been very clear in terms of the ability to continue to provide services to patients who need dialysis, as you have mentioned, as a life-sustaining measure of support. We've also been very clear in terms of whether or not individuals can continue to receive dialysis services regardless of their COVID-19 status, and how employees at dialysis facilities can continue to provide those services with reduced harm to those dialysis center employees and other patients who are in those facilities. It is something that we have been keenly aware of. We have developed guidance, and we will continue to work with them as they have questions on a case-by-case basis.
Thank you. We'll go to our next question, which is from Kevin Petty in Ward 8. Kevin, you are live.
Yes. Good evening, team, and Madam Mayor. Now, I just wonder, I'm one of those that have been quarantined. I quarantined myself for the past 2 weeks, just waiting to see. I was wondering if you can give us any information over here in Ward 8 or whether there are any plans of doing mass testing, because we know that if there are going to be anything done related to this thing, it's going to start from testing.
Well, I want to thank you for that question, and I hope that you're feeling well. Dr. Nesbitt announced this morning that we are working with all of our hospitals and providers to support their testing efforts. She outlined what Children's is doing, what George Washington University plans to do, along with Sibley Hospital and what they plan to do, and one of our larger HMOs, Kaiser Permanente, what they're doing with their members. She also announced the city's plan to stand up a testing site at the United Medical Center. We're working through some of the details with a hospital, with a medical provider that's going to be our partner in collecting specimens in a site at the United Medical Center. Now, I want to address your question about mass testing. What we are going to set up there is a way for people to go in kind of out of the main hospital, but on site of the campus, and get tested. But those are people who will be referred and meet the categories of testing. And it's very important, and we're not saying that everybody needs to be tested, but people who need to be tested, and we need to conserve all of the protective gear and testing kits for people who need to be tested. So you can already contact your doctor if you feel like you have symptoms and need a test, and your doctor will make that decision and get you to the right place. And there will be a larger city-supported location in the coming days, probably into next week, we'll know for sure, at United Medical Center.
Great. We'll go next to John in Ward 2. John, you are live.
Hi, thank you again for holding the event, and I'm sorry I missed the first little bit, but reading the COVID website, the update one, the question was, is construction work now mandated to be closed? And the question from constituents are real estate agents' appointments, which would seem both kind of non-essential, but was just wanting clarification.
We have not pulled any construction permits, and according to the guidance that we issued, construction work that can meet the social distancing guidelines can continue. The question about real estate, is your people showing homes? Is that the question? Okay. And I'm going to have my staff clarify that and look into it. What we know is that what's non-essential is if you have a real estate office and people are coming to your office, that's non-essential. If you're doing work on real estate issues from your home, I think that would fall into a different category.
We'll go to our next question. We're going to Jito Benoya in Ward 2. You are live.
Hello, Mayor. I'm one of the employees here in D.C. that has been affected by the mandatory closures of restaurants. And I've been out of work now since the 15th of March. I completed all the requirements for making a claim to unemployment, which I've never done before, but I believe I've done it all very correctly. received messages in the mail, but as I'm looking here, saying that my claim has errors and that I won't be being paid anything. And this is I'm very anxious about it, and I just want to know if there's any clarification of what's going on with unemployment. And I cannot reach anyone. I've actually been the last 3 days been on hold for over 4 hours and haven't been able to speak to anyone about the issue.
So and I'm not sure what you received in the mail, but we know that there are two things that have been waived during this pandemic that are different than how we normally process unemployment. And that is the requirement to wait 7 days, so you probably fall into that category, and the requirement to be seeking work. And those questions, our system hasn't addressed the waiver yet because we're working on that system change. So what we need to confirm with DOES is that those claims are still being processed. And I'm going to ask DOES to make a statement addressing those two issues.
We'll go next to Shirka Hempfield in Ward 8. Shirka, you are live.
Hi, Mayor Bowser.
Hi.
First, I want to thank you for coordinating the information with the charter schools through the DME.
Sure.
As you are aware, we definitely have seen a loss of the face-to-face instructional time just due to the inconsistency in the internet access. So I was just wondering, as you and your team are working on this issue, is there any definitive guidance around how our at-risk families might be prioritized for receiving the technology and internet that they need?
Well, I know that Chancellor Farabee is working on a plan to prioritize how we're going to use the devices that we have on hand. And that would address the device issue. The internet access issue is tougher to deal with, to be quite candid. There are a couple of programs that have been identified. For example, the cable provider is providing 2 months free cable through one of their programs, and I just would advise families to consider it carefully and see if it works for you. We are also working on ways right now to boost Wi-Fi that would be kind of community available and help some of the Wi-Fi, what do you call those things? The hotspots, to help some of the Wi-Fi hotspots work better. So I know that DDOT is working with a few providers over how we can especially boost our Wi-Fi network in Wards 7 and 8 and work to do that urgently. I'm told that my team is also going to try to procure a lot of these hot spots from different vendors. The Public Education Fund, DC Ed Forward, and a number of foundations in our area concerned about schools have also put together an equity fund, and they are going to discuss how best to use that to both close the device divide and the internet connection divide. But the Chancellor would also like me to remind you, and I'm sure this is true for our public charter school leaders too, is that they've worked very hard over spring break, which was last week for them, to make sure that regardless of connectivity, that they have a curriculum and plan and some take-home work to also do with the children while they're at home distance learning.
All right, we'll go to our next question, which is coming from one of our residents watching live through one of the watch parties online. This is from Thomas Henry, and his question is, what do I do if I see a nail salon in my neighborhood operating after the closure?
I think you can call us at 311, and we will be having some inspectors go out. And I will say, just to give you, and by the way, the prohibition starts tonight. So if you see them before 10 p.m., they are probably winding down. But what I will say is when we issued the first order around bars and restaurants, that night, our ABRA inspectors went out and went to, I think, over 800 establishments, and all but a handful were in total compliance. And so that is what we expect from all of our businesses.
All right, we'll go to our next question from Commissioner Robbie Woodland. Commissioner, you are live.
Yes, hello, Madam Mayor and
Hi.
staff. My name is Commissioner Woodland from Ward HCO3, and one of my questions is, what do we plan on doing in regards to individuals who may refuse to get testing even though they have obvious symptoms? I had a gentleman contact me who said that he was throwing up blood. He lives in a tent city that's over by the State Department and went to George Washington Hospital and didn't feel that he was being treated fairly, so to speak. He felt like he was being judged for being homeless, so he just left. And I tried to meet with him so I could escort him back to a hospital, and he refused the treatment. So is there anything in place for individuals, if we know who they are, that's refusing to have testing?
We continue to have our outreach workers out working with our residents who are experiencing homelessness and who are unsheltered. So we continue to have outreach workers. I have that location, and I'm going to call it to the attention of our outreach staff.
Next, we'll go to Gail Brevard in ANC 501. Gail, you're alive.
Hi. First, I just want to thank you, Mayor. You're doing a great job. Thank you so much.
Thank you.
My question is about parking restrictions. Are they still in effect? I got a question from a constituent who wanted to attend a doctor's appointment downtown and was wondering if she needed to feed the meter.
I think the answer to that is yes. We are, and I'm going to ask the team to do a review this week of any things that we can or should roll back. We have already rolled back rush hour restrictions, and I think there's one other category, street sweeping restrictions. All of those have been rolled back, and we're not ticketing for rush hour restrictions or street sweeping. However, it is still illegal to park in a bus zone. While our buses are running in a limited fashion, they are running. Don't block crosswalks. Don't park in bike lanes. Don't do anything parking-wise that is unsafe. I think that you will find that we've had some more lax enforcement, but we still need to keep the roadways safe.
Great. We'll go to our next question from one of our residents watching through one of the watch parties on Facebook. Letice Moore-Hammond. Her question is, Mayor, how will the government be handling businesses that start to raise prices dramatically on items of necessity?
Well, we have, and I want to thank the members of the council for making sure that our power to do enforcement around price gouging is in full effect during this public health emergency. I had the opportunity to speak to the Attorney General yesterday, and I know his office is very focused on getting out a lot of consumer information about price gouging. His office has also, I know, put up some contact information about how to reach them in the case that they see an incident of price gouging. In addition to that, I asked the Attorney General if he could begin to think about the questions that our residents will get from creditors, card companies, credit card companies, mortgage companies, and help us think through and give advice for how residents should dealing with their creditors.
Great. Our next question is also coming from one of our residents watching on the live stream. His name is Bobby. The question is, how, if my family has some devices that they'd like to donate for students in need, how can they do that?
Let me come back to that because if we're talking about students, I think the fund that we're creating will have a contact, and we can put you in contact with that fund.
All right, we'll go to our next question. So 1 second, loading up the next question here. This is Maria Carey, in Ward 6. Maria Carey, you are live.
Hi, Maria.
Hello, how are you? Thank you for the work that you're doing, and your leadership is very reassuring.
Thank you.
Thank you so much. I am wondering if there are people who can sew or can make masks or can collect other supplies. How can people make those available or donate them to hospitals or to other places that might need them?
We have a central procurement here, and I think Dr. Nesbitt has some information about what our hospitals how they may collect things they need.
So we are still following very closely the CDC recommendations on the type of appropriate personal protective equipment that is necessary for our healthcare providers and first responders at this time. We recognize that there are a number of companies and individuals who would like to assist in making sure that we have the adequate personal protective equipment, including masks. However, we need to be sure that it still meets the safety standards that are necessary in the healthcare system. So guidance around the type of requirements can be found on the CDC's website. And if a manufacturer or individual can meet those standards, we'd be happy to have them get in contact with our procurement agencies. And they can do so through coronavirus@dc.gov.
Great. We'll go to our next question. Aaron Myers in Ward 1. You are live, Aaron.
Hi.
Yes. I would like to first thank you for all the work that you are doing.
Thank you.
I had a question regarding some of the musicians in the city. With the Emergency Relief Fund, some of the musicians reached out and said that they may pay taxes for 2018, 2019. Would they have access to some of the funds within that release bill or not? I'm not sure.
You said they didn't. Say that again?
That they had not paid their taxes for 2018, and I think this was one of the provisions for them to receive some of the relief funds.
We do ask, and forgive me if I don't have every detail of the application point, but we do ask for 3 years of your business experience. If you're a new business, then you can submit your personal filings. And if I'm not completely sure I got your question, but everybody has to file. So we would need your filing.
Great. We'll go next to Miranda Stern in Ward 6. Miranda, you're live.
Hi, my name is Miranda Stern, and I'm in Ward 6, and I signed up for the DC Medical Reserve, but I was just wondering when we'll hear more information on it, if you could let us know a little bit more about the roles and risks involved in participating.
Sure, Dr. Nesbitt.
Sure. So for the first part of your question, we are working through the nearly 2,000 applications that we have received.
Go DC.
So it's a tremendous show of our DC values and how people are stepping up to the plate and really wanting to be central parts of this response. So as we go through the process and vetting individuals, identifying those who already have a criminal background check and getting them prepared for the next round of training, we will be contacting other individuals who need to have further vetting underway. The second part of your question in terms of risk and liability, we offer training. If you are a medical or health professional, we provide you additional training that would be necessary for any role we would have you play as a member of the Medical Reserve Corps. If you are a non-health professional, we provide you training for the types of activities that we would have you do related to your assignment. Under a public health emergency, there are certain liability and risk protections that are conferred to any member of the Medical Reserve Corps.
Great. We have time for just a few more questions. We're going to take a question from one of our council member watch parties. What penalties, if any, will be assessed for those out walking about in the streets after 10 p.m. tonight?
You are permitted to walk in the streets at any hour of the day that you choose. We actually will not be stopping anybody from walking down the street. Okay, so let me put it that way. Having said that, you should stay home unless you're going to some place that is essential for you to be going to. And actually, we want residents to even be more thoughtful than that. People will have to go buy groceries. Plan. Do you have to go every day? Could you go once a week? People have to go to their medical appointments. We understand that. There are people who have essential work that they have to report to their places of work. So we want people to only be making essential trips. Now, you refer to 10 p.m., so I assume that you're referring to my order that all non-essential business in D.C. close. And so we expect all of those businesses to comply. We will have some inspectors out, and if we have to issue fines, we will, but I don't expect that that's going to be the case.
Great. We'll next go to Todd Clark. Todd, you are live.
Oh, but let me go back real quick, Tomas, because the time you will get urged to move along or to disperse is if we see you congregating in our public places, playing basketball games in public parks, soccer games, those types of activities are prohibited, and you will be encouraged to move on.
All right, great. We'll go to Todd Clark. Todd, you are live.
Hi, Mayor Bowser.
Hi.
Hi, thank you for your leadership and for the whole team and staff bringing us good information. I'm the executive director of TIVA, which is the Television Internet Video Association, and I had a question regarding freelance producers, most of whom, many of whom work from home, and is there any kind of abatement or temporary suspension of rent and utilities or assistance for that group?
I think all of our utility providers have indicated that they're going to suspend any disconnection, and we'll post what else they're doing with regard to monthly payments. And I think that's all we have about not just that group, but any utility payer.
Great. And the last question we have is a question related to if families or individuals should start purchasing their own protective masks at this time?
No, we don't think so. In fact, if you do that, then you'll be taking up supply that could be used by medical professionals. And let me just say one more word about that, and Dr. Nesbitt or Chris may want to chime in. Is that we, I think, are working very, very fast and hard with our to make sure that our government officials and first responders, when I say officials, I mean first responders, have all of the PPE that they need. We feel like we got started early in that process and going out to the markets before they tightened up a lot to get the supplies, the personal protective equipment that D.C. government workers who are providing medical care need. But we're also in the market to help our medical providers, our private medical providers, in the case that there is a medical surge here in the district, like we've seen in other places, which we expect to happen, that we are able to help them when their supplies get low too.
Great. And we will go to our last question, which is from Tiffany Johnson, ANC 4B06. Tiffany, you are live.
Hello. Hi. Thank you so much, Mayor.
Yes, thank you.
For all your work. I've been receiving a lot of calls, as have a number of my colleagues on the commission, regarding how seniors who may not have availed themselves previously of DACL services can sign up for and receive assistance with getting free meals or any other type of assistance that's needed. Are they going to be vetted first, or is it if they call, they're immediately signed up to receive assistance?
And thank you for that question. And it sounds like you know how the process has worked, that folks who have been in the aging programs or going to senior wellness centers, they are having meals delivered. And I think Tomas is going to share a number that we can call for anyone else with questions or who needs service.
Yes, definitely. That number for to begin the assessment to get on the list for food is 202-724-5626. Again, that number for seniors is 202-724-5626.
So I want to thank everybody for their questions. I think that we've had many, many people on and many other people watching on Channel 16. And I understand there's also Facebook Live and Facebook parties, watch parties going on that members of the council are hosting. So I want to thank them and all their teams for this engagement and for working with us hand in hand. This really is a one government response to an emergency, and I couldn't be more grateful for the support that we've gotten from our elected officials and from the 37,000 people who work for us in D.C. government. Thank you, everybody. Stay home and stay safe.